Thank you so much for subscribing, liking, and following us as the Healing Stories on YouTube, on TikTok, Instagram, Twitter. Thank you so much. You are the true heroes. Yes, I would like to welcome you to yet another episode of the Healing Stories. And today, this episode basically looks at understanding dental health. And on set today, I bring you an expert, a dentist. But before, there is a thought process behind us discussing dental health. You see, back in the village, growing up in a small town in Chiriandongo district, current Chiriandongo district, of course the Chiriandongo Town Council, we used to see the old women back in the village. I believe this story is also common to you who is watching us. Whenever you had a toothache, they go and they get ash from the previously burnt firewood that they used to cook the day prior, and they put ash in the teeth, okay? Then there are those sticks that somebody wakes up in the morning, is that stick until evening time. It even became a design. When you have the stick and you're moving around the village trading centers, you become the village champion. Yes, but nevertheless, over time, we've had a generational shift. Besides the beauty that people always want to have, nice teeth, people want to have, braces. Braces these days have become stylish, but people are struggling with a lot of issues. Bad breath, brittle teeth, okay? Person tries to bite a bone of KFC or Cafe Javas, and the tooth, yeah, there's something that causes all that. So I'm not the expert on teeth, but what we do here in the Healing Stories is bring people who have the knowledge. Let us share the knowledge, okay? So on set today, I bring you a wonderful gentleman, a gentleman that is passionate about matters concerning oral health. And on set, ladies and gentlemen, allow me welcome the most stylish dentist in town.
Thank you very much, moderator. I'm by the names of Daniel Godwill Akena, hashtag Mr. Teeth. I'm a dentist by profession. Yeah, I come to you today, this wonderful session to discuss on matters concerning our oral health.
Yes. Wow, thank you so much. We are profoundly honored and exceedingly humbled to have you on set today. I know the viewers out there are looking forward to understanding matters in relation to dental health and basically oral health in particular. First things first. What is oral health? What is dental health?
Yeah, actually, oral health, in a layman term, this basically pertains about the state in which the teeth, the gums, the tongue, and other related structures enabling its functionality of mastication, which is eating, speech, smiling, aesthetics, and overall health.
So meaning that dental health is not only the teeth.
Yes.
Because most of the misconception that my brothers and sisters have there is that dentist only works on teeth. Manyo, they call it musawa manyo. But from your definition, I am seeing you're talking about the tongue, okay? You're talking about surrounding areas in the mouth.
Yes.
So all that is work of a dentist.
Yes.
When I have a problem with my tongue, a dentist would fix it.
Yes.
Okay. Wow, amazing. I think I'll pick that. Now, there's a very big problem. Allow me jump so fast.
Okay.
People are struggling with bad breath. People are hiding behind the Mentos. People are chewing PK all the time. Now they have these, there are those oral perfumes. They spray in the mouth. But even with that, the bad stench in the mouth is terrible. You move with someone, someone just stands to say hello. You feel like you're going to run, you want to run away, but out of respect, you don't run away. Why is that a very big problem? And what should the viewers understand from that?
Okay. Yeah, actually, that's really a very, very common condition that is affecting very, very many clients or our brothers and sisters in this current trend, that oral odor. In our layman term, or in a dental language, call it halitosis. Okay? It's very common. Halitosis.
Okay.
Yes. So individuals spend a lot of money to mask that up by using very, very many concoctions in the market. Okay? There are those oral perfumes, someone is chewing Mentos and so on. That's earlier on you say, okay, to mask that. But if you've not yet gotten the cause, okay, that condition will still reoccur. What you're taking in is just to mask it up.
So meaning, as you have said, there's a lot of money being spent to mask the issue of the bad breath. So they are covering the problem, and yet the problem has a root cause.
Yes.
So what you are trying to say is that once the cause of the problem is not sorted, then the problem will keep on staying there.
Definitely.
Wow. You have had.
Definitely.
You have had. Yes. Yeah. So what should be done, and where does this bad smell come from?
Yes. So basically, that halitosis or the oral odor. So there are a number of causes that can really come in from the mouth and outside the mouth. And that kind
what do you mean? What do you mean outside the mouth? Because when you say intraoral inside the mouth, I thought everything comes from the mouth.
Yeah.
What do you mean outside the mouth?
Because sometimes bad breath can come from other conditions one would be having. For example, when one has gastroesophageal reflux disease, so-called GERD.
Hey, those of you have been, some of them, in fact, listening to some of them, of course, during practice, they tell you that I have GERD, so they know GERD. So GERD is what Dr. Daniel is saying, that's gastroesophageal reflux disease. So meaning, when you're diagnosed with GERD, the GERD you've been talking about earlier, those ulcers of yours, somebody can even have bad breath because of that?
Yes, it's because of those refluxes. Whatever you've eaten, acids and so on, it gets back to the oral cavity. So you always feel that unpleasant smell. Then there are also drugs. One maybe you're taking some drugs, like for example, metronidazole. Okay, when you take metronidazole, it gives you that metallic taste. You feel you having that bad oral odor. Okay,
so metronidazole is the flagyl that people take.
That one.
So when somebody is taking flagyl, they always give it 2 times 3 adult dose.
Yes.
Brings that metallic taste, and when you take it for so long, it can also bring about the bad odor.
You'll feel like I have a bad odor. Okay. That one is basically, we call it pseudohalitosis.
Pseudohalitosis.
Yes.
It is you who feels it, but actually it's not there.
But I'm not feeling it. I'm talking to you, I'm not feeling it. But you who feels it. Okay. Yeah. Then there are also drugs like these people who have withdrawal syndrome from alcohol, disulfiram. Okay. When they take that drug, they also give them the same feeling. So those are some of what we call the extra oral. They don't come from the mouth. They come from other parts of the body. Could be the stomach, could be the nasal cavity. Okay. Like this condition, which is very common, known as maxillary sinusitis.
Yes.
Okay. Because there is a fluid buildup in the maxillary sinuses. So there is no drainage. Okay. So
what our people call sinuses?
Sinuses, yes.
What they call sinuses?
But idea sinuses are just spaces in bones.
They are just spaces, yes, that's true.
So
the condition is sinusitis.
Because there's inflammation in the maxillary
So there's a swelling inside that cavity or that hole. So that swelling becomes fluid filled, patches it up. So the smell that comes is from the fluid. That fluid, because it's not draining out.
So makes one feel that bad breath. Okay. So that's why I was telling you, there's what we call the intraoral bit of it and the extraoral bit of it. Okay. So now let's look at the intraoral bit of it. Okay. Like for the best example I can give you is what we call dental caries or tooth decay. Okay. Dental caries basically, it's a multifactorial disease of the hard tissues in the mouth, which are the teeth. Okay. Whereby you have holes in the teeth. Okay. So when you eat something, food gets stuck in there.
In those holes.
In those holes.
In the teeth.
Okay? Yes. And when food gets stuck in there in the mouth, we really have microbes in mouth, which are normal to be there in the mouth.
It's what they call the normal flora.
The normal flora. Okay. So now these microbes would be given chance to break down, to bring
that food that was stuck inside there.
Bring what we call volatile sulfur compounds. Okay. That's why anyone with holes in the mouth are not attended to. Okay. There will be bad breath because there's a lot of debris stuck in there. Even the food that you ate in the previous Xmas, you may get surprised, still in there.
Still in there. Oh,
yeah.
Hey, the food you ate the previous Xmas may still be stuck there, and the bacteria that's in the normal flora there is breaking it and bring out that what do you call it? The disulfiram what?
That volatile sulfur compound.
The volatile sulfur compound brings that stench. Wow.
Yeah. Oh. So now that's one of the causes, the dental caries. Then we also have gum diseases.
Gum diseases.
Yes. Because the gum is the surrounding that some have black gum, some have pink gums. Okay?
Yeah.
So when they get inflamed or diseased, in the layman, in the medical world, it's gingivitis.
Gingivitis.
Okay? When
the swelling of these gums here.
Yes.
Mine are black. They're black.
They're dark.
Anyway.
When the gums get inflamed, okay, there are times whereby as they progress, infection, the gum progress, they begin to form pockets whereby you get filled with pus around the gum area.
Wow.
Okay. That's now where we have a condition called necrotic ulcerative gingivitis. Okay, it's very, very common among immunosuppressed patients.
So those are patients who have diabetes, HIV, and so other conditions that destabilize the body's immune system.
When they neglect their oral health, they are prone to that.
Do not neglect your oral health.
Yes, so you're prone to that. Okay, now in an environment whereby there is cell death, there is pus in that area, definitely you'd have a bad breath.
So we have talked about this. We have seen where the problem is and we've seen the cause of the problem. But anyway, before we come and tell you how to handle this issue, allow us to take a short commercial break. We shall be right back. Welcome back from the commercial break. Keep on subscribing, keep on following us on our social media handles, drop in those comments, because from those comments and that feedback that enables us to serve you better. But before we went for the break, we're understanding matters halitosis, matters bad breath, and matters in relation to dental health. Of course, with the one and only Mr. Teeth, a man who is very passionate about the teeth. So, Mr. Teeth.
Yes.
We have been talking about the bad breath.
Yes.
Now we know what the problem is. We know where the problem is coming from. Now, what I would like to seek your indulgence in is, now the problem has come. Somebody has bad breath. Someone out there has bad breath. What should they do?
Okay. Yeah. Actually, from the starting statement we made, we spent a lot of money masking up the bad breath.
Yes, covering up.
Yes, without getting to know the root cause.
The root cause of the bad breath. Yes.
Okay. So there are still other causes. Like, for example, there is a common condition called oral candidiasis.
Oral candidiasis.
Yes. Oral candidiasis, it's basically caused because of the change of the flora in the mouth. Okay, that favors the growth of yeast-like infections. Okay, because these Candida albicans are yeast-like. Okay, in nature. Okay, in the mouth. Okay.
So the Candida that women get the other side, it can also be in the mouth.
Very much possible.
Okay.
Much possible. And there are very many causes. Number one, oral sex.
Oral sex.
What? Oral
candidiasis. You have had oral sex.
Yes. It can predispose one to oral candidiasis. Then the use of the very many mouthwash on the market, by the way. Okay. Ideally, when you're getting this mouthwash, it's supposed to be recommended by your dentist or your doctor. Okay. But now there are individuals who use this mouthwash day in, day out. Okay. And this mouthwash has got what we call antimicrobial ability. Okay. They can kill whatever kind of microbe in the mouth. Okay. As we cited from our statement, we have what we call normal flora. We have microbes that are there in the mouth that are not what? Harmful. Okay.
So when you use these mouthwashes without prescription,
yes,
every day you think it is swag, you think it is being on another class. You kill.
Yeah.
You kill these things that God gave you to protect.
Yes.
Oh, you see how your money can bring you problems.
So when all those microbes are killed, okay, the pH of the environment changes. Okay, because these microbes help us to match with the what? With the pH. Okay. Now, when there is a pH change. pH is like as we have what we call acidity, alkalinity, and neutral. Okay. So when the pH is changed, okay, it will favor the growth of what we call the Candida albicans.
Wow.
Okay. That's when you'll have what we call candidiasis.
So meaning the oral candidiasis comes from two sides. That one, as you have explained, and then the oral sex.
Yes.
The other one goes the other side, puts the machine there and brings it to the mouth.
We have also types of candida in the mouth. Like the most common one is also called pseudomembranous candidiasis, whereby you see someone having a white patchy-like appearance in the tongue and other parts of the oral cavity, where they scrape them off and they leave bit of erythematous or bleeding. Area gets inflamed, That also causes what? Bad breath. Then you also have another cause, like for example, is what we call the wisdom teeth. These are teeth that comes in last.
The last teeth.
Yes.
At what age again?
They range between 16 to 20, 18, around there.
16 to 20 years when they begin growing.
They begin growing. So most time when they come, when they're not fully erupted, there's an overlying flap, covering that tooth. When that flap, when one beats on it, gets inflamed at times. Making a lot of forming pockets. That debris gets stuck there. In our language, it's called pericoronitis. Because underneath that flap, there are food debris, there are microbes in there.
So the food particles that we eat go in there and they hide.
Yes.
So when they hide there, they begin rotting. When they rot, then the smell comes out.
Smell, yes.
Wow.
That's called what? Pericoronitis. So our viewer there, when you get to know the cause of the bad breath, you should be able. It would help you know how to overcome the bad breath.
Yes. Now that is the most important point. Don't hide in the Mentos, in the PK and the oral perfumes.
Yes.
Now we have the viewer out there. They have this bad breath. Now, when they have this bad breath, what message you have for them?
Yes.
What should they do now?
Thank you very much. So, what advice I can give you is when you have tooth decay or teeth with holes in the mouth that needs to be worked on, visit your dentist. They'll do fillings in them so that in a way that those holes are filled up. Even if
and
you
food
eat,
cannot hide there.
Can't hide in there. Then we have got the tongue itself.
Yes.
Has got what we call papilla.
Yes. Those hair-like structures on the tongue.
So now those areas tend to stick a lot of debris. When you're brushing, someone will tell you, I brush day in, day out, like thrice in a day. But I still have what? Bad breath.
Still have bad breath.
But are you brushing the right way? You clean the tongue.
You have seen what you have said. Are you brushing the right way?
Yeah. So now, as I told you, when you don't clean your tongue, those papillas have a lot of food. That's why you need to when you brush, you also clean the tongue. It's what we call tongue scrapers. You use it to clean all those debris around the tongue. It will help you out. Then number 2 is our social life. There are things like oral sex and so on. You can desist from that.
Yeah, very important.
You don't get that bit of what? Halitosis. Then the gum diseases, they are prevented by a number of ways. You should also get that habit of the way you go to the hospital to do your general body checkup. Visit the dentist and do a dental checkup. You see, dental health is really neglected by very, very many individuals as far as statistics are concerned. Very few individuals take keen about their oral health. They only get the dental health seeking
when they feel pain.
When there is pain, which is really very, very wrong that way.
Dear viewer, I think you have heard. If you have a bad breath in the mouth, let's first find out what the cause of the problem is. And how are you going to find the cause of the problem? Visit the dentist. Let the dentist make a thorough oral assessment and to find the cause of the problem. Let them treat the problem from the root cause. Because when you treat the problem from the root cause, then the problem disappears.
Yes.
So, very importantly.
Yes.
And there are those lifestyle modifications I've told you. If you have diabetes, if you have HIV, if you have cancer, and those other diseases that bring about immunosuppression, of course, it increases your chances of getting halitosis if you do not take good care of your oral health. I think I've said it right.
Yes.
Yeah, so most importantly, let us get the problem from the root cause. Let's approach it. Now, talking about brushing, I think this is the point whereby I think you should emphasize about brushing. Most of us brush, but do we brush the right way? What should we do? What's the right way of brushing?
Yeah, so now, number 1 is what's the best time for brushing?
Best time for brushing, yes?
I always recommend, because most of us always busy in schedules, you're in office, doing what you get. So ideally recommend mostly the best time. You shouldn't or you should never and ever forget, is when you're going to bed.
When you're going to bed?
Yes.
Okay.
Then after having your last meal of the day, either supper or dinner, you must make sure you brush your teeth.
So that is the best time for brushing?
Yes.
Okay.
Though after every meal, you can rinse. You can rinse. Okay. But the best is when you're going to bed. And another thing is, we have to be gentle with our brushing. You get? Because I've noticed someone goes to the bathroom and spends like 30 seconds. I'm done with brushing. Seriously, what have you done? And they're fighting with a toothbrush. When you look at the sink, there's bleeding blood all over. You get? Now, when you look at our mothers, okay, you know, when someone is pregnant, okay, there's a lot of hormonal imbalance.
Yes, okay? Hormonal changes occur during pregnancy.
Well, we have the progesterones and the estrogens. Those are one of the hormones that are important in the maintenance of what? Of pregnancy. Okay? Now these hormones here have a tendency affecting what we call vascular permeability. Okay? That's why when some pregnant women will always visit the dentist and complain, we have sore gums. You get? Because there is an issue with vascular permeability because of the mismatch in the hormones. Okay? Because
so meaning a woman who is pregnant, if they go and begin fighting with a toothbrush, the chances of their skin inside the mouth breaking is higher.
It's very high because of the blood flow. Okay, there's what we call pregnancy-induced gingivitis.
Pregnancy-induced gingivitis.
Yes.
Wow.
It's the inflammation of the gums, but because of what? Pregnancy.
The hormonal changes due to pregnancy.
Imbalances. Okay.
Wow.
So the build-up of plaque in the mouth and the microbes in the mouth, okay, because of the hormonal imbalances in the body, the blood flow into the areas it's compromised. The cell defense mechanisms isn't adequate enough, okay, to fight. You get?
Okay.
That's why they're always prone to getting what?
The bad breath and the gingivitis. Now, how that woman there, that pregnant woman, that mother of 9 months, 7 months, 8 months pregnant, and other colleagues.
Yeah.
Fine, we have known. You see, I love the way you're submitting. You're beginning from the root cause, moving upwards. Very brilliant. Now, we have reached that point there in the bathroom.
Yeah.
This one is brushing 30 seconds.
Yes.
Okay? Now, what should be, you've talked about the ideal time being when you're going to bed or after the last meal.
Yeah.
The most ideal time.
Yes.
So after every meal, it's good to rinse.
Yes.
Okay? Now, how should I do it?
Okay. Yeah, thank you very much. As I've told you, we have to be very gentle.
Yes.
Not fighting
gentle, don't fight with the toothbrush.
You get sink full of blood as if you've been in a war.
You think it is a butcher.
Yeah, so we have to really be much more careful. Number two, this gets back to our kind of toothbrush we're using.
The kind of toothbrush, wow.
There are very many toothbrushes on the market. I'm not here to market any company and so on. So we have to know what kind of toothbrush you're using. The best recommended toothbrush to use is supposed to be a soft, bristled toothbrush.
How would you know that one?
A soft, bristled toothbrush. Okay? So you can look at your toothbrush, those bristles that you use to clean with your teeth. They have to be very, very what? Soft, not hard.
So you get it when you put your... Some of you use toothbrushes whereby you rub your hand, it even cuts your hand. So
that's very hard. Okay. Ideally, you're using that hard one. You're using a lot of abrasions. I always get my patients.
But the patient told me, Mosa, this one here, it's on which kakuta murunji.
Yes, kakuta. You're ideally shredding. Like, for example, you get steel wire and go to the wall, okay? You begin brushing. You see?
It will just clear. It will not clean, but actually just damage.
Yes, it clears everything, whether it is dirt, whether it is paint, there is cement, everything goes. That's the same is going to happen to your what? To your teeth. Okay? Because there's a lot of abrasion. You're adding in forces to brush.
So it should be soft.
It's supposed to be soft. You have to be gentle. At a given time, you hear someone coming. I brush every day, but I have sensitive teeth.
When I take something hot or something cold, I feel masanyara the electricity.
Yes, I feel sensitive. Because the brushing, at a given time, around the areas where we call the gum margins tend to recede.
Begin
growing down.
Eroding.
And they begin forming micro cracks or holes around the teeth. On all surfaces. don't get surprised. Someone opens up the mouth, coming in for a routine dental checkup, and the whole teeth have those micro cracks.
Now we have talked about the soft toothbrush. So, okay, I have gone to the supermarket, I have got the toothbrush, I have tried it, it's soft. Now, me when I go to brush, I'll put mica toothpaste on it. How should I brush?
Okay.
Should I? For us, we do like this.
Okay.
For us, you get it and with water and put on your suit and then run to work.
Yeah. So now this is ideally supposed to be this way. Okay.
Wow.
This is our mouth. This is our toothbrush.
So it should be soft like this.
It's supposed to be soft.
Wow. This is wow.
Yes.
This is very soft.
It's supposed to be soft. Okay. Now, when you're going to brush after eating your meal, okay, you get another thing. Let me talk about the toothpaste.
Yes.
They always ask me, which toothpaste is good?
Which toothpaste is good?
Toothpaste can I use?
Very good.
And so on. Okay? Any toothpaste is good so long as it has fluoride in it.
So meaning when you're buying toothpastes, you should look at the box and see if it has fluoride.
Yes.
Okay.
Fluoridated toothpaste, it's the recommended standard of the kind of toothpaste we're supposed to use.
Okay.
Because tooth decay doesn't start in a day or a fortnight. It's time dependent thing. Okay. So when tooth decay starts around the enamel, this white glassy-like appearance of the tooth, and you brush very well with the fluoridated toothpaste, the fluoride in the toothpaste does remineralize the tooth. Okay. So there will be no progress of tooth decay. Okay?
So it adds on minerals on top of what you're cleaning out.
Yes, it builds up a stronger bond. Okay, bond, because what makes up the tooth and the bones we have, it is the same chemical component known as hydroxyapatite. Okay, hydroxyapatite.
Wow.
So that keeps the strength. That's the main inorganic component of the what? Of the tooth. Okay. So when you use the fluoride, it makes the bone more what? Stronger. Okay. The bone in the hydroxyapatite crystals.
Yes.
Yes. It forms a complex which makes it very, very what? Strong.
Very strong.
Yes.
Wow.
So when you're going to brush, get a little of water.
Little water.
Put in the mouth. Hold your toothbrush at an angle 45.
Angle 45
yes, just like this. Then you apply slow, gentle, circular motions. Toothbrush and water. Without toothpaste.
First way. Hey, hello. Me what I know, even from boarding school, get your you get your toothpaste, get the brush, put it there in your mouth, you run and brush. That is it. But for you, I say, you first use water alone.
And the toothbrush. Only.
Water alone and the toothbrush.
Yes.
And I'm saying, for us, I saw you trying to do
slow circular motion. Yes. So
but doesn't that need the gym, the hand?
No, not really.
Okay.
As I told you, we have to be gentle. Why am I saying water and toothbrush alone without toothpaste? It's because as you're going to use the water and as you brush, slow circular gentle motions, you're removing all kinds of debris or food particles that were left in there in the mouth. Okay? You brush them all out, you rinse and spit.
Circular motion.
Yes, slow, circular
slowly,
motions.
gently.
Yes. Because when you use back and forth aggressive motions, you'd cause gum recession, gum bleeding. Okay,
it's what causes that bleeding when you're brushing because you are doing this.
Because this is part of your body, the gum. Okay, it's part of your body. But now why fight with the gum? Really,
you're fighting with yourself.
Fighting with yourself. So when you brush without toothpaste, then you rinse and spit. Then you put a pea-sized toothpaste,
small like this.
Small.
Oh, our people got the extravagant. They will not know that toothpaste is there, not until it starts from here up to here.
That's a pea size, something very small. Then you brush gently around the what?
The same circular motion,
the biting surfaces. You don't forget the tongue, okay? Then after brushing, spit and clean the toothbrush. You clean the tongue, clean the toothbrush, place it back.
Wow.
Because most times, someone goes and brushes for like 30 seconds and rinses and goes. That's not ideal.
Wow.
I can
So
give you a
I
scenario.
have done this. Wow. And then 20 minutes, 20 seconds later, I moved out. Wow.
So now I can give you a scenario. There's what to call detergents, Omo and so on. Yeah? Our mothers there, they buy the Omo and they put in water also, and they put their clothes. Do they wash immediately or do they give some time so that the clothes can soak?
Of course, they soak, then they wash.
Yes, the same to your teeth. Okay, after brushing, leave the paste in the mouth so that they get enough time of contact. The fluoride in the toothpaste to get enough time of contact with the teeth. Because ideally, when our mothers get our clothes, they put the detergent and just do this and rinse. Will the clothes be clean?
No.
No. So give it time to soak. The same to what? The teeth.
So after and after spitting, I first wait for how long?
You basically brush, spit, clean the tongue and the mouth, but don't rinse. You can sleep with the toothpaste. That's no problem.
That is at night.
Yes, at night.
What about in the morning when you're going to work?
Now in the morning, when you wake up in the morning, just wash the face, rinse, have breakfast, brush.
That's why you see the whites in movies. They actually have breakfast even.
Breakfast in bed. That's what they say.
They have breakfast in bed. Anyone that is simple here. You have not,
okay.
We are learning a lot today.
Yeah.
And if there was time, it would be here the whole day. But unfortunately, our time is fast spent. Our time is indeed fast spent. But what I've picked, what I've taken home, or what I've learned from here, is that the toothbrush should be soft
bristled.
Yes. Even when you're brushing, we first put in the water, then gently, circular motions. You first clean the teeth, remove the debris, then that small pinch of toothpaste, same gentle motion, then spit, allow the toothpaste to remain there. But as you allow it to stay there, then clean your tongue. Okay? Clean your tongue and other areas of the mouth. Wow. Amazing. I know we are going to have further discussions. I'd like to thank you for coming on set.
You're welcome.
But I know our viewers there would want to meet you. I know you work with a team of dentists. You are called Mr. Teeth and other dentists.
Yeah.
Where would they find you?
Currently, we have a team at Victoria's Dental Care, Victoria's Medical Center. We are located around Kampala Ginger Road.
Okay.
At Lico Holdings, the same building with Equity Bank.
Where Equity Bank is?
Yeah, just
opposite Shell.
Sure.
As you are going to Boyogerere.
Yes, around there. So we have a team of experienced dentists.
Okay.
Yes.
They're there every time or they're on appointment?
Every time. Anytime walking, from 8 to 8, they're always there.
Wow. 8 to 8. Wow. Victoria's Dental Care, Chireka.
Yes.
Wow. Amazing. Wow. Our dear viewers, kindly do not forget to put in those comments. Your feedback is very essential for us. Click on that subscription button, like this video, and follow us on all our social media platforms. Mr. Teeth, Dr. Daniel Godwill Akena, thank you so much for coming on set.
You're welcome.
And kindly, we request for your audience next time when you're invited.
Thank you.
To our viewers there, till we see you again. This is the Healing Stories. Life is precious. Act fast. Thank you so much. I remain Alex. See you again next time.